Hello, this is School Committee Update today with Ward 2 member Ilana Krepchin. I'm Sarah Fishman. How you doing, Ilana?
I'm well, thank you. How are you?
How you doing?
Good.
Okay, we might have a little bit of a delay here, so before we get knee deep and ankle high into how to cope with COVID, can you give us just a little background on you and Somerville and your involvement in the schools?
I am happy to do that. I have lived in Somerville for about 20 some odd years in a couple of different locations. I've lived in my current condo in Ward 2 for about 15 years. I live here with my husband, who is a nurse at Boston Medical Center. So when we dive into COVID, I can talk a little bit about him and his experiences. And my daughter, who is currently 13 and in 7th grade at the Argenziano School. I started being involved locally in the schools when my daughter started in kindergarten, and I was the PTA president at the Argenziano for several years before I dove in and decided to run for school committee. And I have been on the school committee now for a little over a year.
And how long were you head of the PTA at Argenziano?
I was on the board.
How many years approximately?
I was on the board of the PTA for 4 years. I was the president for 2 years.
Because this is a very logical trajectory for people to get that sort of experience on a PTA board and then run for school committee. So presumably that was your, helped you take on the very awesome burden of being in this position. Okay, so let's talk a little bit about your husband. So he's probably already vaccinated, right?
He has been fully vaccinated. Yes, he got his first vaccine that first week in December when Pfizer first got shipped out, since he's at a major city hospital among the first.
Yeah. So has he had to do COVID patient treatment, or has he been in a ward where that hasn't been specifically what he does, or what's his specialty?
Yeah, he is on a general med surg floor. So in normal times, he sees a whole variety of different kinds of patients. Back in April and May, it was all COVID all the time on his floor for about 2.5 months. So it was very intense for him and for all of us, of course. This most recent surge, and then, in the summer and into the fall, it got back to elective surgeries and his sort of normal patient load. And he didn't have any COVID patients for quite a while. And then in this most recent surge, it was about half COVID patients on his floor and half other types of patients. So it was a little less stressful this time around than the first surge for him.
Mm-hmm. No, that's good. So I saw on Facebook you were doing something with making gowns. Was that a volunteer effort, or what exactly was that?
So I am a member of the Artisans Asylum here in Somerville in Ward 2, where I typically make jewelry. So that's what my day job is making jewelry. And at the beginning of the pandemic, the Artisans Asylum closed down for regular use because everything closed down. And there were a number of members who are kind of go-getter, makery kinds of people and always want to jump in when there's a problem and try to solve it. I'm not necessarily that kind of person because it's not in my skill set, but I am the kind of person who's going to jump in and help if I can be helpful. So there were a number of people who saw the need for PPE, saw some of the materials and equipment at the Artisans Asylum that could help that happen. And so they jumped in to start producing gowns, shields. That was the bulk of it, was gowns and shields. So I did quite a bit of volunteer work at the Artisans Asylum.
So what did you produce? How many things? How many?
I don't know that off the top.
Roughly,
But there were thousands and thousands of gowns.
Wow.
I don't know exactly how many.
Good for you.
There was a really impressive group of people who came up with really good systems and equipment to make it happen in a pretty efficient way, given that, you know, we're not a factory that makes gowns. It was pretty impressive. And it definitely helped my own emotional well-being to have something productive that I was able to do.
And to feel like you're addressing the problem, presumably.
Right.
Yeah. So, and this is also consistent with your, as far as I know, your general personality, because you and I have met before, packing lunches at the Connection on Broadway, school lunches. So I imagine that felt very good. Yeah.
That is another one of my favorite volunteer jobs. I was just saying that
in the lunches,
that packing the food is another one of my favorite things to volunteer doing because it feels so tangible.
It's very satisfying. Yeah, exactly. You do it, you put your hands into it, you know it's immediately going to someone who needs it. I agree. Food and good differ by only one letter.
That is true.
You know. Yeah. Okay. All right. So let's talk about how your family is coping with COVID. So your daughter you have a daughter. She is 13.
13.
Is that right?
Mm-hmm.
And we can say her name.
Yep. Molly.
Molly. She goes to the Argenziano school.
Correct.
Yes. And so what grade is she? 7th?
Yep.
Okay. So how has she been doing with remote instruction?
I would say overall, she has handled it better than some other kids that I'm hearing about. She's a pretty easygoing kid. She loves to read in her spare time. She started taking daily walks with a couple of her friends back in the summer, and she's an early morning riser, and they started taking their walks in the summer before it got too hot. So they started taking walks very early in the morning. And she continued doing that even when remote school started in September. And I think for her, getting up and getting out of the house and taking a walk before everything started has really helped her. Exercise, fresh air, some time in person with her friends. I think that's been really great.
And she was able to be, so she's been with people who she otherwise would have been in the classroom with?
Correct. Her
is it
peers.
Neighborhood friends?
It's both.
Yeah.
It's both.
Okay. Well, they're probably related.
Yeah. So that's been really helpful for her.
Okay.
Academically, you know, she doesn't love sitting in front of a computer all day, but she also doesn't hate it. It's just, she has a sort of, it is what it is attitude about everything.
So how do you feel she's fared from your perspective in terms of instruction hours? Do you feel she's advancing, getting what she needs, learning what, either in volume or depth or whatever?
It's a good question. I know the teachers are working so hard. I know some content can be delivered much easier in a remote setting than other content. I've never had a huge amount of worry about her academically. She's always been a pretty self-guided, go-getter kind of kid. So whether she's where she would be academically if this were a regular school year, probably not. Am I worried that because of that, she's going to fail in some future way? Not particularly. Does that make sense?
Okay. Yes, it does. But do you think that the longer this goes on, the more children are at risk for getting behind, whatever that might mean?
Absolutely.
Yeah.
And not just academically, but socially.
Socially, yeah. I keep thinking, what would it be like? I've been trying to project because I have a son who's in college now who did K through 12 in Somerville. But I'm trying to think, what would I feel like? You know, how would I feel about the education my child was getting? So let's talk a little bit about in-person versus remote instruction. would you feel that it's safe for Molly to go back to school? Or are we not there yet in Somerville?
I think Somerville has done a very thorough job of looking at HVAC and surveillance testing and protocols in buildings, that I feel like we're ready. And I when the time comes, will
Okay.
actually feel comfortable having my daughter go.
So you say when the time comes. So how does
Well-
one know? How does anyone know when that could be?
Well, I mean, specifically here in Somerville, we have a proposed timeline of how this is going to happen in the coming months. And so it's starting with
Okay,
our highest need students will be going back starting next week. And then there is a rollout schedule starting with the youngest students of when they will be going back into a hybrid model.
okay, so that's starting next week, definitely.
Yes.
Okay, that's interesting. Okay, so because not just in Somerville, but in many districts, things have been predicted to start in one time and then,
I understand that, but with our high school with the certificate of occupancy at our high school, that has been that's a huge piece of real estate that has state-of-the-art HVAC. So part of what has held us back up to this point is the HVAC improvements that the city has been putting into our buildings have just taken a lot longer than predicted originally. So that's what's going on specifically in Somerville. It's a little different than surrounding towns. But phone calls
so
have been made.
when did the occupancy
We just got the occupancy certificate for the high school. I believe it was this past Friday.
Okay. Mazel tov, as they say in some places.
Yes.
So does this mean that students who are not high schoolers will be using the high school? Or
Unfortunately,
does it
yes, that
mean
is what that means.
What does it mean that the high school is?
So it's a little complicated.
Why unfortunately?
Well, because we would love to see our high school students
imagine.
in our high school building using this beautiful new high school, especially because so much of their high school experience has involved construction, even before COVID hit. But because of our priorities of bringing the highest need students back first, and then our younger students, because they have the hardest time engaging in remote learning or getting anything from it. Because of that, and because it has been deemed that several of our buildings won't have their HVAC done in time, there are going to be some groups of students from certain buildings who are going to be using part of the high school.
Okay. So that was going to be my next question is, how are the other schools doing? How many have to be online, so to speak, to accommodate the full district population, or whatever proportion of that is the goal to accommodate?
So it's a little complicated, but there are several schools, my understanding anyway, there are several schools that are very close to being done. So our first round of students coming in that are coming in next week are going to be at the high school. And then going forward, as we're rolling out more, the Capuano, the Argenziano, and I believe it's the West, I apologize if I'm not getting exactly which one's right, are coming online soonest. And that will allow pre-K and K to start in. And then, in the East. It is the Winter Hill and the Healy that are going to take a lot longer for their full HVAC improvements. So it's the younger kids from those two schools that will be at the high school.
Okay. And this all starts as of next week? Wow. So in that case, going to Governor Baker's, what do we call it? It's a plan. It's not exactly a mandate, but a call to action. He has just a couple of days ago, right, said that he wants to see all children K to 8, correct me if I get this wrong, all children K to 8, full-time, in-person instruction by April-ish. Is that, what is your reaction to that?
So
Plan.
you got it right. That is essentially what he said. I think there's some cynicism as to why he's coming out with that right now, in terms of perhaps deflecting criticism of him about the vaccine rollout. I'm sure that he is experiencing a lot of pressure from parents, which I completely understand. But I think that this has to be decided locally. And I don't know how much, unless he is throwing lots and lots of money at many districts who need resources in order to improve their HVAC. I'm not sure how practical or realistic what he's saying is. The other thing that I find a little confusing is that the CDC guideline still talks about keeping students 6 feet apart. And I don't know that there are many districts in the state that have that kind of real estate if they had kids in 5 days a week. So there's still just so many questions. I'm a little hesitant to put much stock in what he said.
I think it's very confusing. And for one, the CDC, I think, says 3 to 6 feet.
Okay.
It either says 6 or 3 to 6. The
Okay.
state has said 3 is sufficient, I think. And there's a lot of talk about that. And it seems like there's some consensus. I think there was some letter that was sent by a bunch of pediatricians and physicians saying we encourage students to return in Massachusetts, and saying if you follow other mitigation strategies, 3 feet could be enough. But if children are wearing masks and if they're eating, then they're not wearing their masks. So I don't get it. I don't see how this can be perfectly done regardless, kind of thing, you know? There's
a lot to consider, and the guidance is confusing coming from different places at different times.
So what would you like to see? Are there specific things? Maybe I should phrase it this way. What has the school district done well in moving things along? And what does it need to do better? Or do you need to see happen to feel comfortable for your daughter to go back to the classroom?
So it's been an interesting time for sure. Somerville is in a unique position in that our school buildings are owned by the city, not by the schools. So there was a decision by the city made early on about these HVAC improvements that we, the school committee and the superintendent, have had no control over. And so we have just been trying to do our best with what we have in terms of the city's talking about what improvements need to be made in order for any of these buildings to be used. I won't say whether that was the right decision or not, because it was not my decision to make. But what the school committee and the district have done is our best with what we've been given from the city in terms of when the buildings would be ready, which has been pushed back.
Are you saying there was no? Are you saying that the school committee didn't have any? Are you saying the school committee did not have any input in that, or that it wasn't possible to have input given who had authority over what? And you're on the subcommittee on finance and facilities, right? So
I am.
You someone who would be in on this.
The city made a decision that HVAC needed to be at a certain level before any kids could enter any buildings. And that was not a decision that the school.
And I think we should just, okay, we should probably quickly say that stands for
Oh,
heating, ventilation, air conditioning. It's air circulation, right?
correct. Air circulation.
Yeah.
Yes, that is correct. I apologize.
Yeah, okay. All right, so that, but I think a lot of districts have used that as, you know, a goal.
Yes. But a
A
lot of
necessary
districts
goal to be met
have,
before.
yes, and I'm not saying that it's not the right goal. My concern is that in retrospect,
Right.
we may have been able to get small numbers of our highest need students into certain spaces earlier had we not waited for this entire systemic problem to be fixed. But
Got it.
hindsight is 2020, and we are where
Okay.
we are.
So, I guess you didn't, I guess maybe I didn't. So for Molly to go back, we need to have good air circulation. Do you feel she needs to be 3 feet, 6 feet apart? Do you feel that the teachers need to be vaccinated?
So I
What
think,
else has to happen?
yeah, I understand your question. I think that with the current proposed mitigation methods that Somerville has, that I would feel comfortable sending my daughter back in a hybrid model now. I think as far as the 3 feet goes, I feel like I need more information before I could make that decision, because I feel like we really won't know if our mitigation measures are working until we actually start this process and get some teachers and students into the building. I am confident from what I've seen from our proposed safety measures that we're going to be able to do that. So my hope is that as we get rolling this along and can show that our safety measures are working, and as teachers start getting vaccinated, of course, I don't know when that will happen because that is a state decision, but as that happens, whenever that does happen, I will feel more confident about rethinking the 6 feet versus 3 feet conversation.
It's a very intense matrix, because one variable can slide one way and then another variable can take precedence, and it's not easy to pin down.
Right.
So how, if you had to rate how the city has handled COVID up till now on a scale of 1 to 10, what would you give it?
Maybe a 7. I feel like the city has done
and
a good job keeping everybody safe, but I worry sometimes that it has gone too far in the safety direction at the peril of mental health and other concerns that go with keeping everybody isolated.
Do you have a sense, I tried to figure this out, how many communities have been remote only up to this point? Because I believe Somerville is in a distinct minority in that.
Somerville is definitely in a distinct minority in that. I don't have the number off the top of my head. We certainly aren't the only district that has been fully remote till now, but it's definitely a minority.
Yeah. So it's sort of a chicken and egg kind of thing. So like in Medford, which is granted smaller, I'm reading from Somerville Journal from last week, at the end of November, all students through 8th grade who opted for in-person instruction had returned to in-person learning. And currently, this is written a week ago, all students K-12 who didn't opt out are engaged in some in-person learning. So you read that and you think, you know, it's really hard to compare. It's really hard to know. Now, this district is like 16% smaller than Somerville. So that might have something to do with it. Maybe they have fewer buildings that have to be mitigated for better ventilation. I don't know. We don't have a whole lot of time left, but I want to just get are there any other sort of general reactions? How has the union responded to Baker's plan for in-person instruction?
That's a good question. I actually don't know. I haven't read anything from our union as to what they're saying. I know I've read some responses from the state level union as to what they're saying. I actually don't know what our local union leadership is saying about it.
So was there any agreement in place or understanding in place between the Somerville Educators Union and city government as to what, teachers and staff wanted in order to get back in the buildings? Or
So
is that not how it works?
We have been having ongoing negotiations once a week, sometimes more, since all of this began. And it's again been a little bit of a chicken and egg problem, because if we didn't have our buildings to open, even if the teachers had said we want to go back, we didn't have buildings for them to go back to. So there's been a lot of back and forth. There were some intense negotiations around what the metrics and thresholds should be to show that it was safe to go back in terms of community spread. There was a lot of back and forth, but we do have an agreement in place around that, which is what is allowing us to start this in person going forward next week. And we're still negotiating aspects of exactly what that is going to look like going forward in terms of what the day will look like during this hybrid schedule. And I should also clarify, the highest need students who are going back next week, they are in small self-contained classrooms. And so their classrooms are small enough for them to be going back. So that there's no hybrid schedule for them, because the classes are small enough that they can just be going back. So the negotiating
Rhode Island.
I'm sorry, I missed your
believe
question.
some Rhode Island schools refer to that as podding. I said, I believe some Rhode Island schools refer to that as podding in place.
Okay.
So and this is what makes it easier for younger kids to go back, right? Because they're with their peer group as opposed to high schoolers who are going. Anyway, I'm sorry I interrupted.
No,
what were
not
you
at
going
all.
to say?
I already forgot, but I think I covered it.
Okay. Is there any last word you want to say, or we're going to have to wrap up? Any advice, or just hang in there, everyone, kind of?
Yeah, I mean, just hang in there. I
Yeah.
hear lots of feedback. Everybody's concerned. I get it. I take it all in. I look forward to seeing those students come back starting next week. And I'm confident in our safety measures that we can do this safely.
All right. Well, on that hopeful note, we have to end. This has been School Committee Update with Ilana Krepchin. Have a nice day.